All right. So this is what the robotic platform looks like. You have a binocular vision. You are looking with the two eyes inside it. So it has the vision. It has the stability of the camera because you yourself are controlling the camera. The instruments that we use, they have a 360-degree range of motion. So we can move them practically in any direction, even more than the human hand is actually. So if it's even more than the human hand, we get a very high definition 3D, three-dimensional vision. We can even magnify up to 10 times if you want to see something very, very closely. That's why it's a very precise surgery right from the beginning to the end. And because of all these angulations and things and be able to rotate the camera and the instruments, everything, it's easy to suture. It's also it's a very robust suture. The surgeon sits and operates. So even if it's a very complex case, then operator fatigue or surgeon fatigue does not set in, and which generally tends to diminish the efficiency of surgery. So if it doesn't happen, the surgery becomes very efficacious. And like I said, 4 things are controlled by the surgeon. Of instruments which can be done by a single person, which is why there is a very high single time. Like so small that the real tips are so fine and so precise that we are able to do very delicately. Now I want to show you, I hope it doesn't get disconnected in the midst of this. This is how much finesse there is to the surgery when we do this. So this is a grape, like a normal grape, not a big California grape or anything, just your regular grape. And using just this was a demo thing to show how precise the thing is, without bursting the grape or without tearing off the petals. I don't think I don't know if there are any of us, at least I don't know any such person who do this with their bare hands. To peel a grape using this, we are able to do surgery as precise and as fine as this. That's how much is the surgical precision. So if there is that much precision within the abdomen, you can imagine little collateral damage is happening to the other tissues or the organs around. And that's why the healing is very rapid. Patients hardly ever have any pain after the surgery. Sometimes they even don't believe they have undergone surgery, because neither do incisions where these instruments have gone in, neither do they pain, nor does the surgical site pain, because the surgery is so precise. It's like you can appreciate how fine is the movement that is being carried out. Of course, this is not somebody who's doing it independently. Is the robot is not an independent person, but there's a surgeon behind it. So what are the benefits to the patients when we do this? There is significantly less pain and scarring. They have much more comfort post-operatively. Of course, because of all this, the blood loss is less. They require very few transfusions. Now for myomectomy, we don't even keep blood in hand. We just cross match it and keep it at all we need it. And in most cases, we don't need it. There is a much risk of infection. The hospital stay is much less because the recovery is fast. So medications use less. Recovery time and overall return to work is also much faster when we do surgery using this platform. Because the incisions are very small, then there is also for women, of course, that's important. There is improved cosmesis as well. Overall, in many clinical situations, better clinical outcomes and patient satisfaction with robotic surgery. So you see the big incision, the vertical one is replaced by 5 small holes. The horizontal one is also replaced by 5 small holes. And what is the advantage? Terms of surgical advantage, it is a magnification if we need to see things quickly. There is surgical ergonomics. We are working in a situation which is not taxing to the neck or the back. There is less surgical fatigue, and of course, because of that, there is less potential for error. And even in complex cases where laparoscopy is never a good idea, like obese adhesions and very large masses or previous surgery, we are able to tackle this successfully. Now these are 2 of my patients. I'm going to show you the videos. This one doesn't have a voiceover. The other one I think has some voice in it. So this begins with the MRI image of the patient. The MRI is showing a really big fibroid, and then you can see a couple more in the image.